My name is Dr. Michael Veselak, and today we're going to talk about the organic acids test and why this test has become my favorite test that I use to try to find objective evidence for neurotransmitter deficiency and in helping us navigate mood disorders. There are basically three types of neurotransmitter imbalances. First, there's deficiency, which can be caused by GI issues, stress, dietary problems, or related to drug depletion or taking different drugs. Second is damaged neurons. This can be caused by toxins or physical trauma. And the third cause is genetic factors. Now, the organic acids test, when you do the test, the first page is basically an overview. So you kind of look at certain things. So you can look at like the need for antioxidant support or oxidative stress, mitochondrial support, which the mitochondria, as you know, helps with maintaining energy in the cell, creating the ATP and helping convert food to energy. Inflammation, that's kind of a big one. Toxic exposure, and the last one is methylation. So it's just a general overview we look at, and then the test kind of breaks it down a little bit more. So like with this particular individual, you can see that there are a little deficiency in some of the B vitamins. And so when you're talking about methylation in mood disorders, some kind of big ones are folate, so B9 and B12. That's kind of in the category of need some more B9, folate, and B12. And then we want to look at other ones. So zinc can be related to mood disorders, deficiency in zinc. So, and then the glutathione is a little bit low also. So it just kind of gives you an overview of different nutrients that are deficient. And then when you get in the test, it becomes a little, overwhelming at first. So what I want to do is just show you the markers that I look at. So here you can see we have neurotransmitter markers or metabolites on the right side, and kynurenine is a vitamin B6 pathway. So what we're seeing here is this patient is deficient in some B6, and you need B6 to make the neurotransmitters. They're also very high in what we call quinolinic acid, which quinolinic acid is a marker that shows there is a lot of brain inflammation, and this is actually not good. So this has to be reversed for sure. And then it looks at the next category down, catecholamines. So catecholamines are, homovanillic down here, that's the metabolite for dopamine. So we can see it's in the green, so dopamine is good. Vandemandellic is a metabolite for norepinephrine, epinephrine. We're kind of in a moderate range, so we're kind of having a little issue there. And then the serotonin marker we kind of abbreviate as 5-HIAA, and we're kind of in the need for certain things to help that. So when we just look at this, just for neurotransmitters alone, we're not looking at these dysbiosis markers or cellular energy, any of that, although it is very important. But for the purpose of this lecture, we're just kind of looking at neurotransmitters and what we want to look at. So we have an issue with B6, quinolinic acid, brain inflammation, and then we have the need for some norepinephrine and serotonin support. Here's just a brief diagram to kind of show you how the pathways work. So you need phenylalanine, which goes into tyrosine, which goes into L-DOPA. B6 is needed, so we saw we had some B6 issues. So if you don't have B6, you're not going to convert L-DOPA to dopamine. And then you can see you need copper and vitamin C to turn dopamine into norepinephrine. And then SAMe is your major methyl donor. So if we're deficient in methylation, it's going to affect that to convert it to epinephrine. And then some of the metabolites are for dopamine. The metabolite is the homovanillate, which I told you, HAVA. And the metabolite for norepinephrine is VMA right here. So when we look at this, so we're looking at when we see a problem with, let's say, norepinephrine, epinephrine, looking at that previous pathway, we want to make sure that we have enough dopamine, enough phenylalanine, enough tyrosine, So as we look at the chart, and here's another chart showing the same thing. So basically phenylalanine to tyrosine, and then tyrosine is very important for thyroid also. So tyrosine is an amino acid that we definitely want to address. And then tyrosine and the dopamine in the norepinephrine, epinephrine. All these COMT, that's the genetic part of the methylation, and the SAMe, very important. You can see copper, B6, they're all real important. And then, as I said before, as dopamine comes down, if the patient is very inflamed in the brain, it will turn into quinolate here, which a cytokine means inflammatory activator, a chemical messenger of inflammation in the brain, where picolinate over here is a chemical messenger for more body inflammation. Okay? And then one more chart almost saying the same thing. So it goes phenylalanine to tyrosine to dopa to dopamine to norepinephrine, and then there's a metabolite for norepinephrine, and your metabolite for dopamine is the homovinylic right here. The serotonin pathway is, it starts with tryptophan, then you need all these things to make it work. Iron. You have to be able to methylate. Niacin, vitamin C, which goes to 5-HTP, which sometimes is given to speed up serotonin, 2-serotonin, and then the metabolite is 5-HIA. Now, what's real important is you have to have amino acids. Amino acids, if you're deficient in one, it's going to affect all of them. So sometimes poor stomach function or poor digestion can lead to a decrease in amino acids. And when that happens, your body's ability to protein or synthesize protein is going to be reduced. That means all these things are going to be affected. You're not going to be able to make antibodies. Your enzymes are going to be affected. It's going to affect your cell energy. Detoxification is going to be affected. Thyroid hormone can be affected. Insulin and the controlling the blood sugar can be affected. Your follicle stimulating hormone, which affects your overall hormone production, is going to be affected. Hemoglobin, neurotransmitters, and that's the purpose of this lecture, is how amino acids affect neurotransmitters. So here is your 20 essential amino acids here. And we can see we're having an issue with phenylalanine. So we saw in the previous chart, phenylalanine starts the whole process. It goes phenylalanine to tyrosine to L-dopa to dopamine. So now we want to take a look at some other ones. So here's the tyrosine, having issues there also. And then tryptophan, kind of not doing great. And then so with this particular patient, you need to support phenylalanine, possibly even tyrosine and tryptophan. So I would probably give this patient a free-form amino acid or each individual supplement to kind of help the production of those. And then when you redo the test in, let's say, 3 or 6 months, you should see that quinolate go down, so no more brain inflammation. And then you'll see things like mood changing, right? So less depression, possibly less anxiety, better sleep, less brain fog, real big things here. And then when you support the amino acids, it's going to affect the other things that you're not even thinking about. Like I said, energy production, blood sugar regulation, antibodies, so the immune system, right? Big stuff. So, here's the pathways again. So we got tryptophan going all the way down to serotonin. This doesn't really show it, but it goes phenylalanine to tyrosine all the way down to dopamine, norepinephrine, epinephrine. So by giving tyrosine, tryptophan, this individual should improve drastically with that measure. And then you want to look at other things that I said are important for, let's say, brain health and mood disorders. So fatty acid balance is super important. Plus, fatty acids are super important for your cell membrane. We have a biphospholipid layer that protects us. So if you don't have protein and you don't have good lipid, good fatty acid balance, you're going to have poor cell membrane health, and that's going to create issues. Thank you so much for listening. Hopefully this helps you navigate. And like I said, the organic acids is really kind of my favorite test because it really allows you to look deep inside and figure out what's going on with that individual. Thank you.